No, I mean,
all the questions.
So talk to us about your plan that you're unveiling today.
Yeah. Well, we have to do something. I think Americans are asking for some help. Health insurance costs have went through the roof under Obamacare. Premiums have went up 200%. Deductibles have went from $1,000 a year to $15,000 a year. So we've come up with our own particular plan. We want to, number one, is address the fraud in Obamacare. About a third of the people on Obamacare don't ever file a claim. So there's significant fraud going on there. We want to, as far as the enhanced subsidies, we want to extend them for 1 year and then start transitioning to where we take that money and put it into your healthcare savings account. We pair that with price tags. We force healthcare providers to show you the price tags. Look, Americans are great shoppers, and whether it's Black Friday when you're doing shopping or shopping for healthcare, if we give patients all the information, we give them choices, the prices, this is going to start bringing the cost of healthcare down.
Several of your Republican colleagues have introduced other healthcare proposals. When can Americans expect to get some clarity on where Republicans stand on healthcare, what the Republican plan is?
Yeah, I think there's going to be clarity come through this week, but unfortunately, since the Democrats kept everything shut down for so long, I don't think we're going to get a definitive answer this week. We've got to do the right thing as well, and we're working very hard on a bipartisan basis for a long-term solution. We want to expand funding for community health centers to make sure everybody has access to health care. We need to take on pharmacy benefit managers, which are driving up prescription drugs. We need to start selling health care across state lines as well. So there's at least a dozen, probably 15 things that we need to do to bring down the cost of health care. What I would stress is which my plan is the one that's actually going to bring down the cost of health care for everybody.
The president hasn't endorsed any of the particular bills. He said today a version of what he wants, but he hasn't been very detailed. Is the president sitting on the sidelines of this ongoing discussion?
We're having conversations with the White House, but I believe the president has confidence that Congress can figure this out, and that's what we're trying to do.
Should he be more personally involved in trying to find a solution to this?
Yeah, I think that he's probably right where he needs to be. I think we as senators, the House needs to do their thing. We need time to work this out. Look, this is simple. This has been going on for 15 years. Obamacare has been the law of the land for 15 years. We're giving $150 billion a year now to insurance companies. So the insurance companies are getting rich. Meanwhile, Americans are getting the short end of the stick here.
Thank you, sir.
Thank you, Senator. Appreciate you stopping.